Yeah, just
One.
yeah.
Tell me when. 1,
2,
3, 4.
5,
6.
6,
7, 8.
10.
Alrighty, so I'm going to be talking about multiple sclerosis. The general purpose is to inform, and the specific purpose is to inform how multiple sclerosis affects the body. Many people have heard of multiple sclerosis, MS for short, but not many people know about this rare disease. So imagine you're sitting in a doctor's office and you hear the doctor say you have a disease that 1 in 750 people get. There's no cause, there's no exact cause of it, and there's no cure. Your symptoms will come and go and it'll last the rest of your life. People who are diagnosed with MS hear something like this. I have firsthand experience with this because my boyfriend's mom, Mary, was diagnosed with it a couple years ago. According to...
Just take a breath.
You're good. You're good.
Okay.
Nervous.
It's okay.
Okay.
According to the National Multiple Sclerosis Society, about 2.3 million people are diagnosed with it. Some of those could be your loved ones. I'm going to talk about what exactly MS is, the different types, how to live a normal life, and what are the treatments. So what exactly is MS? MS is a rare and unpredictable disease that occurs when the immune system starts to attack its own tissues. This results in the damage of nerve fibers. These nerve fibers will make sending a message to the central nervous system or brain difficult or altered or stopped. The amount of damage that is done is resulted in neurological symptoms. There are 4 different types. The less severe type is the clinical isolated syndrome. This is when someone has one neurological episode, and this episode may happen again or it might not. So doctors usually put these people on preventative medications so that hopefully they'll never develop MS. The second and most common type is called releasing or remitting MS. This is when neurological episodes occur in waves. So like one day symptoms will be really bad and the next they won't. Secondary progressive MS results when neurological functions in the central nervous system get worse and result in less mobility and confusion. The fourth and final type is primary progressive MS. There's no early release or remission, but as each onset of MS, the neurological function will worsen. People who have MS might have a difficulty living a normal life because the damage that is being done to their nerve fibers won't be able to send messages through the body. Some of these symptoms include numbness of the limbs, lack of coordination, slurred speech, and pain in the body. There will be changes in emotional health because people who are able to walk one day won't be able to the next. And this can result in a feeling of depression. Sorry, guys.
You're fine. You're doing good.
Ain't nobody here actually bites.
Hey, it's just us.
I've seen this firsthand with Mary. One day she's doing really good and the next she's confused and in a lot of pain. As a family, we try to keep her upbeat and active. MS affects people differently. You have Mary that are able to do stuff on their own, and then you have those who are bedbound and rely on people to take care of them. With advances in medication can help living with MS a little easier. There are different types of treatment, such as treatment of helping the relapse, which will result in the course of the disease. So the transmission of the disease, like the symptoms, won't occur as often as they would without the medication. There are also symptoms to help treat symptoms such as depression, difficulty walking, pain, and fatigue. Combining all these medications will result in the person having a better quality of life. Hopefully hearing about MS, you have a better understanding of what the disease is. There are many symptoms of MS that affect a person both emotionally and physically. Many people have heard the name multiple sclerosis, MS for short, but most people don't know about it. MS is a hidden disease that affects the body severely, which makes it a difficult disease to live with.
Very good.
Very good.